Good morning. Today's class is going to be about suppurative osteomyelitis. So what is osteomyelitis? Osteo refers to the bone, myel refers to the bone marrow, and itis refers to inflammation. So basically, osteomyelitis refers to the inflammation of bone and its marrow contents. Suppuration basically refers to pus formation. So suppurative osteomyelitis is nothing but the inflammation of the bone and its marrow contents, which ultimately result in the formation of pus. Suppurative osteomyelitis can be classified into acute suppurative osteomyelitis, chronic suppurative osteomyelitis, and infantile osteomyelitis. For today's class, we're going to be seeing about the acute and the suppurative types of osteomyelitis. So, coming to acute suppurative osteomyelitis occurs as a sequelae of your periapical infection. So, infection from the periapical region spreads to involve the bone, causing inflammation of the bone and its marrow contents. This inflammation, in turn, results in the necrosis of variable amount of bone. So what causes this acute suppurative osteomyelitis? As I said previously, acute suppurative osteomyelitis can be caused by a spread of infection from the pulp to the periapical region, or it can occur as an acute exacerbation of a chronic lesion like your periapical granuloma and your periapical cyst. It can also occur as a result of jaw fractures from traumatic accidents and as a result of hematogenous spread. So infection from the bloodstream can settle in the bone of the jaws, resulting in osteomyelitis. So your acute suppurative osteomyelitis is a polymicrobial infection. Multiple microorganisms are involved in the cause of these infections. So the ones most commonly noted are your staphylococcal as well as your streptococcal species. Example, your Staphylococcus aureus and your Staphylococcus albus. Certain anaerobic organisms are also involved in this infection, including your bacteroids, your Porphyromonas as well as your Prevotella species. In some instances, certain specific microorganisms can cause your osteomyelitis. When osteomyelitis is caused by your tuberculous species, we call it your tuberculous osteomyelitis. Similarly, when your osteomyelitis is caused by your actinomycosis species, we call it your actinomycotic osteomyelitis. In these types of infection, this particular organism predominates. So, moving on with the pathogenesis. So, once the bacterial infection reaches the bone marrow, our body produces an acute inflammatory response. So, it produces your acute inflammatory cells that try to kill off these invading microorganisms. This in turn results in the production of an inflammatory exudate. This inflammatory exudate spreads through the marrow spaces, and as more and more inflammatory exudate accumulates, it causes the compression of the local blood vessels present in the bone. This in turn causes obstruction of the blood flow and thrombosis, resulting in ischemia. So this ischemia in turn results in necrosis of variable amount of bone. So as more and more inflammatory exudate is produced, this inflammatory exudate or pus begins to fill the marrow spaces, and from the marrow this pus begins to extend to involve the cortical bone. So once it reaches the cortical bone, it then involves your periosteum. This inflammatory exudate or pus causes lifting of the periosteum, which further compromises the blood supply to the bone, resulting in further necrosis. At this stage, your osteoclasts come into play and they try to remove this necrotic bone from the surrounding viable bone. So by the action of the osteoclast, the necrotic bone begins to separate from the surrounding living bone, and this results in the formation of something called as your sequestrum. So your sequestrum is nothing but necrotic bone that separates from the surrounding living bone by the action of your osteoclast, and this sequestrum slowly begins to exfoliate by the formation of a sinus. So coming to the incidence, your osteomyelitis can occur at any age. Males are more commonly affected when compared to females, and mandible is more commonly involved when compared to maxilla. This is because of the poor vascular supply and dense cortical bone of your mandible when compared to your maxilla. So a person suffering from acute suppurative osteomyelitis experiences severe pain, trismus, paresthesia of the lips if mandible is involved, fever, and regional lymphadenopathy. Within the oral cavity, teeth involved in that particular area may be loose and sore, and the patient might find it difficult to chew any food in that region. Exposed bone may also be noted in that particular area. Pus may also be seen extruding from the gingival margin. Acute suppurative osteomyelitis progresses rapidly and shows little radiographic evidence at the early stages. Once it has progressed for about 1 to 2 weeks, individual trabeculae begin to appear fuzzy and indistinct and radiolucent areas begin to appear. You can also note widening of the periodontal ligament space, loss of lamina dura, and loss of circumscription of the inferior alveolar canal when noted on the OPG. The histopathology of acute suppurative osteomyelitis is not specific. The medullary spaces are filled with inflammatory exudate consisting chiefly of neutrophils. Few lymphocytes and plasma cells may also be evident. The osteoblasts lining the trabeculae of the bone are usually destroyed. The osteocytic lacunae is usually empty, and with time the bone shows resorption. The management of acute suppurative osteomyelitis involves debridement, drainage, and antimicrobial therapy. When the intensity of the disease decreases either spontaneously or under treatment, a sequestrum usually forms. As said previously, a sequestrum is a dead bone that separates from the surrounding living bone by the action of osteoclasts. If this sequestrum is small, it exfoliates through the oral mucosa by the formation of a sinus. If it's large, it has to be removed surgically. In some cases, this sequestrum may become surrounded by new living bone, and this is known as an involucrum. If proper treatment of acute suppurative osteomyelitis is not initiated, it can result in certain complications. The first complication is periostitis. Periostitis refers to the inflammation of the periosteum. The inflammatory exudate from the bone marrow can spread to the cortical bone and then to the periosteum. Here, it can cause inflammation of the periosteum, leading to a condition called periostitis. The second complication is a soft tissue abscess. So, from the bone, the lesion can spread to involve the surrounding soft tissue, causing an abscess. This abscess can then result in the formation of a cellulitis, where the inflammatory exudate is no longer confined to a particular space but spreads along tissue spaces and planes. Finally, the last complication would be your pathological fractures. Chronic osteomyelitis can be broadly classified into primary chronic osteomyelitis and secondary chronic osteomyelitis. Primary chronic osteomyelitis is a type of non-suppurative osteomyelitis that is chronic in onset, while your secondary chronic osteomyelitis is a suppurative type of osteomyelitis that often develops from acute osteomyelitis. And for today's discussion, we are going to be seeing only about your secondary chronic suppurative osteomyelitis. Chronic suppurative osteomyelitis usually develops as a result of inadequately treated acute osteomyelitis, and rarely it may also develop as a complication of radiation therapy. So, coming to the pathogenesis, when acute suppurative osteomyelitis is inadequately treated, our body's defenses tries to produce granulation tissue in an attempt to wall off the infected area. This encircled area acts as a reservoir for bacteria, resulting in development of chronic suppurative osteomyelitis. The signs and symptoms of chronic suppurative osteomyelitis is similar to that of acute suppurative osteomyelitis, except that they are milder. Acute exacerbations of the chronic stage may occur, and this suppuration may often perforate the bone, resulting in the formation of fissurous tracts. Coming to the radiographic features, chronic suppurative osteomyelitis develops over a period of 4 weeks, and hence diffuse areas of radiolucencies may be noted on X-rays. Coming to the histopathology of chronic suppurative osteomyelitis is not specific. The trabecular spaces are often filled with chronic inflammatory cells like your lymphocytes and your plasma cells. The osteoblasts that border the trabeculae of bone are often destroyed. The osteocytic lacunae is empty, and fibrosis may also be evident within the trabecular spaces. The treatment of chronic suppurative osteomyelitis is quite similar to that of acute suppurative osteomyelitis and involves debridement, drainage, followed by antimicrobial therapy. In refractory cases, hyperbaric oxygen therapy is often recommended. This hyperbaric oxygen therapy enhances the local immune response of the jaws and induces new angiogenesis for reperfusion support and aids in the faster healing of chronic suppurative osteomyelitis. Thank you.